Australian High Commissioner His Excellency Jon Philp and Health Minister Jelta Wong were in Lae this week to inspect the Angau Hospital Redevelopment. They visited the project site at Angau and 2 health centres in the city that are still under construction. The Angau Hospital Redevelopment will provide improved access to joint health services for the people of the Momase and Highlands Regions.
It's not just this hospital we're talking about, it's all the supporting structures that Dr. Bingham was talking about outside of this hospital, outside of Lae, all the smaller facilities that really also need to work if you want this hospital to function as it really should.
For so many years we've budgeted money into the health department, but it hasn't gone to the right places. Now now that we're here at this stage, we've looked at where we went wrong. We've learned from the past so that our future can be brighter. And with the government's intention is to ensure that every Papua New Guinean is not left behind. We want to ensure that you have a choice to go to any health facility in our country.
The inspections were part of a 2-day visit to Finschhafen and Lae this week. The Joint Staff International Development briefed them on the progress of the construction, and then they moved to the new children's outpatient, pathology and birthing and nursery facility. One of the main concerns raised by the departmental heads was the lack of manpower to carry out quality health care services to the patients.
So having a structure does not necessarily mean best service. We must have all the components put together. So we must also have proportionate increase in the human resource. So human resource is not only doctors, but midwives who make this service flow. Again, to the statistics, we have 14 midwives. 14 midwives for laboring mothers. So this means that there will be about 1 to 2 midwives per shift looking after these 35 deliveries per day. Just overwhelming.
The delegates then moved to West Taraka Health Centre in Yuan Gulf District and Tent City Health Centre in Lae, currently under construction. The 2 new urban health centres have TB clinics, outpatient, emergency, maternity and child health services. The Australian government funds the 3 project sites visited.
What Australia is putting here is something that will last for years and years, and it provides quality, and I mean quality health service for our people. And I'm very privileged and honoured to come again and go through and to ensure that we're going down the right track.
The tour was then led by Lae MP John Rosso to Milford Haven Clinic at Papuan Compound, where a 5 million kina health facility will be constructed by the Lae City Authority.
The whole idea is for the health facilities in Lae to have, instead of everyone congregating just at Angau, we have in each ward a proper urban mini hospital, that level 3 facility that takes the pressure off Angau. It also will be useful. There will be a dentist based at each one of them. There will be X-ray facilities at each one of them. There will be a doctor based at each one of them. There will be residents for our clinical staff there. There will be also birthing facilities there for our mothers and our women, so that they can be easily livable in their wards and be attended to in their wards, instead of everyone congregating on Angau. Angau will be now more a referral hospital for everyone else, and to handle major care, major intensive care sort of thing.
Julie Badui, Owa, National EMTV News, Lae.